Chronicles of a Play Therapist podcast is raw, unfiltered, and unapologetic, discussing mental health from a play therapy specialization, including trends, treatment approaches and techniques, theory, and the business of psychotherapy practice. Get ready to learn and play with your host, licensed clinical social worker and registered play therapist supervisor, Althea T. Simpson.
Welcome to another episode of Chronicles of a Play Therapist. I am your host, Althea T. Simpson, licensed clinical social worker and registered play therapist supervisor. I am the founder of Unicorn Life Training and Brighter Day Therapeutic Solutions. So today's podcast is all about EMDR and play therapy. That's eye movement desensitization reprocessing. It's a specialized treatment for resolving trauma. Now, research also shows that it is effective for treating mental health conditions like depression, anxiety, and anger. Now, I have been a trauma-trained and certified professional for about 12 years. I've used a lot of different types of trauma treatment modalities, including NARM, which is Neuroaffective Relational Model, TFCBT, Trauma-Focused CBT, and I even did a 12-week case-based study training in neurosequential model with none other than Bruce Perry. That was super amazing, but I am not formally trained in EMDR, nor do I use it in my practice. So I want to bring on one of my favorite child therapists, child clinicians, child play therapists, Jackie Flynn, who is a licensed mental health counselor supervisor, registered play therapist supervisor, and also formally trained in EMDR and is a EMDR. And so I'm mixing it up. So I'm just going to bring Jackie on, but she's also a consultant for those who want to get trained in EMDR. So Jackie, welcome and thank you for being here.
Oh, thank you for asking me. Girl, you have so much training. I know you're one of my go-tos. You have so much information, and now I know why. You just go after all the cool stuff. So I am honored to be here, and I'm honored to talk about EMDR and how it works with kids. I'm excited. Thank you for inviting me.
Well, thank you. So tell us a little bit about yourself, and then you can just go right on into telling us about EMDR and play therapy.
Well, I'm a registered play therapist, and then I'm a licensed mental health counselor supervisor. So I work with supervisees, and I consult with EMDR trained therapists. So most of the EMDR trained therapists that I work with are child therapists. So we focus on how to use it with kids. And it's a type of therapy that really helps. We think of trauma as a distressing or disturbing event. And that can happen like way back in utero or pre-verbal. So even just children, naturally, they have a developing brain. So luckily, it doesn't rely on kids having any aha moments, insights, or information, or even being able to articulate what they've been through or what's happening to them. So typically with kids, we see it work quicker than we do with adults. Now, every situation varies, but it really works on the memory network. So imagine I'm 46 years old. If I had that I'm not good enough or I'm a bad person cognition, it may flow back to 46 years, right? But if I'm 6 years old, I only have a little bit of that. So it's less work to go through when we think about like the acronym EMDR, the desensitization. The D stands for just desensitization, and reprocessing is the R, is to take the emotionality out of whatever is happening or whatever has happened, and then reprocess the cognition. So if they have a shorter lifespan, there's less work to be done. Unfortunately, though, a lot of the kids that we work with, even in their short little lives, they have so much trauma.
Absolutely. And, I specialize in working with trauma in children who have experienced trauma that's in the foster care system. But I'm not unfamiliar with EMDR. I think I was probably traumatized when I worked at the American Psychiatric Association. So my department developed practice guidelines that treat different mental health disorders. So I was doing the research and, product development in the mental health realm. while I was in the business world. So before I even came into the mental health world. And so I was on a work group call, and these psychiatrists just going back and forth. And I remember thinking, oh my gosh, these are professionals that's going back and forth about EMDR. And I could swear that if we were in a room, something probably would have broke out because that's how back and forth they were about EMDR. I'm not unfamiliar with it, but for me, I was like, I really didn't understand it. And back then I wasn't in the mental health field, so I really didn't, think about more into it. But recently, there's been a boom with people getting EMDR trained. And I was just like, okay, I just never thought. And I think for me, it was that experience that made me not look at EMDR. And I didn't understand it, so I didn't try to find out more about it. I found other models that really resonated with me. But it wasn't until I was talking to you I think it was about a month ago or 2 months ago. And I'm very transparent. And I was explaining to you about my, experience with COVID and how I felt betrayed by, the therapy community, play therapy community. And he was like, that's kind of like a trauma. And EMDR would be great for that. And when you explained it to me, I got EMDR. So I'm not the type of person that'll just jump on, trendy training, or it has to make sense to me. And I have to see how I can, fit it into my practice with my clients. And it wasn't until you explained it to me that I got it. And then to see how you incorporate it with play therapy, I can't wait to finish my NARM certification so I can start my EMDR certification. So one of the things, if you don't mind, if you could explain EMDR to the world like you explained it to me, because there may be other people struggling that don't get it. And the way that you explained it is something that's common that we all experience, but it made the connection for me.
Okay. And I can't take credit for this analogy, although I can't remember exactly where I heard it. It's definitely not mine. But sometimes we feel stuck in life. We feel emotionally stuck. We may understand things intellectually. We may know that, and let's take, for example, someone that's smoking. They may know that smoking is going to lead to cancer, or someone may know that purging and binging could potentially cause them to, die, or we know these things, but we're behaving in a different way. So sometimes we just feel stuck. We just feel stuck in behavior patterns. We know we need to get out of bed and go to work, but we just can't gather the energy to get up. EMDR helps to really get to the root of it, and it helps to really dislodge those things that are stuck. So imagine that I'm driving along one day and I get in such a bad car accident at no fault of my own, that the next time I go to get into the car, I feel all of these big body sensations. We call them somatic sensations. And my heart starts beating, and I start to kind of feel the symptoms of a panic attack. That's something that just me having knowledge, having insight, just having support may not necessarily help with. It goes deeper than that, right? It's a trauma that I've experienced that my body and my brain has really taken to heart that I am not safe. I'm in danger. Mm-hmm. So EMDR helps with those situations and stuck. So this analogy that I shared with you is something that I am kind of selective who I share it with, because it doesn't necessarily go over well with everyone. But to me, it made sense, and you took on to it too. So imagine that you haven't went to the bathroom in a long time. Not bowel movement. You haven't went to the bathroom, and you feel constipated, and it's really rocking your world. Your stomach's hurting. You don't want to go anywhere. It's hard to get comfortable. You're eating differently. Just like a blah, like I have to go to the bathroom and I can't go. Well, there's some things you could do, right? You can take some laxative. You could eat more fiber. You could get more exercise. You can drink water. There's all kinds of things you can do, right? Just like in life, we have like a lot of choices generally. So imagine that I finally go to the bathroom, and it's not the most pleasant thing in the world, right? I don't want anybody there around me that's going to remember this bathroom experience. It may be messy. There may be an odor to it, and there may be some unpleasant sounds. Just when we kind of look at it as a metaphor, it's kind of like when our clients go through this trauma, it's not a pretty sight. It's painful. Pain is something that demands to be felt, right? So you have to let that process happen. So once you go to the bathroom, going back to the bathroom metaphor, after you've gone, it's like, oh, okay, I feel better. So you may feel tired. You may need to air out the bathroom, turn on the fan, put in the light a candle, whatever it is your process is, and then take a shower and you go to bed. Then the next day, it's like you're not kind of really, but you may remember that you went to the bathroom, but that's not the number one thing on your agenda. Now you can focus on life, right? So EMDR is something that allows you to put the past in the past and live in the present. So if I was to think about that trauma of the car accident, I could then go in the car. I would cognitively remember, hey, yeah, I got in an accident. That was a pretty bad accident. But the emotionality would be decreased in my body, and I wouldn't have those big somatic reactions in my body that's leaving me stuck in my tracks. And that's the beauty of EMDR. It's not depending on someone just having information or somebody being able to have the information and recall and apply it. It truly helps to heal the brain. When they do pre and post brain scans, you can see there's changes in the brain after a certain amount of EMDR sessions with people that have been diagnosed with post-traumatic stress disorder. So when we look at like using it with children and teens, they have developing brains. They have limited life experiences. They don't know what to say with certain situations. When I go to therapy, I don't know exactly what to say that's going to be that magical expression that's going to make me heal, which is also the beauty of play therapy, right? So when you integrate play and EMDR therapies together, it is an ideal combination to use with children and adolescents because it truly helps the brain heal so that they can go on with their growth and development, and they're not stuck by those limitations of I'm not good enough, or I'm not safe, or I'm not in control, I'm powerless, or I'm a bad person, I'm shameful. There's these cognitions that kind of keep us contained. And with children, we want all of those positive cognitions, as many as possible, so they can go on to just be the best version of themselves that they can be.
Oh, well, thank you so much for explaining that, because like I said, when you explained it, I've known about EMDR since, I was at the American Psychiatric Association in, I think, late 2002 to 2006. So I'm familiar with EMDR. And like I said, even then, it just didn't make sense for me. Mm-hmm. And you have made it make sense with that analogy or that metaphor. And that's a part of what we do as play therapists. We work in metaphors. And that's why, oh my God, yes, I get it. It doesn't sound pretty, but it's something that we all experience.
We all know, everybody.
Yeah. And it's like Chronicles of a Play Therapy is unfiltered. It's real, it's raw, it's given information. That was the purpose of starting this podcast, to give information related to play therapy because it's so effective. Not just for trauma, but I primarily use it for trauma. But it's so effective. It's an effective and amazing magical treatment modality. So in essence, what it sounds like is that EMDR kind of helps the brain digest the memories of traumatic experiences that people have.
Absolutely. And sometimes there's no cognitive memory. So suppose somebody's 1 year old or even 1 month old, and their parent or someone is holding them in their arms when a hurricane is happening. And there's all this disturbance and all this distress around them. They may not remember that hurricane. They may have had someone told them about it or not, but their body feels the emotional memory of that. Or even in utero, if their parent is in a car accident when they're pregnant with them. So not only helps with like the memory, like as we think of it cognitively, but the somatic reaction that goes with that. It's really, really amazing how it works.
I think that that's why, and I love training. I believe that if we're going to start implementing any type of treatment modalities, we have a responsibility to not only read about it, but also to be trained in it by professionals who have that knowledge and that experience, especially when working with children. Because a lot of people, especially trauma memories, people think that children do not have trauma memories, and they do. It may not be exactly how it happened, but they remember a lot of those experiences. And, so if you're not trained, one, to work with children and adolescents, but two, getting the training of the specialized training that it takes to work with this population, that is just so important, because children, they have some, like, if they have trauma, they may have like nightmares, or they may avoid those traumatic experiences. And when I think about it, I think about bullying. That happens a lot in school. A lot of people don't see bullying as being traumatic, which it is, but that child may try to avoid going to school, or they may become disruptive or defiant toward their parents and the teachers in the school. So I think it's super important for us to know, one, what trauma is. A lot of people mistake trauma as being something heinous or like horrible that happened to you, but trauma is how people experience situations or events in their life. So we cannot tell someone that they're not traumatized. And that's why I know in this world, big trauma and little trauma, I cringe at that, because if you call someone's trauma little, to me, that's invalidating their experience because it's big to them. And so I avoid using big trauma, little trauma, because I believe that it invalidates someone's experience. They had a traumatic experience, and we cannot tell them that they didn't have this experience and it wasn't traumatic to them. But we also can't tell them when they healed from it. So it's like healing is individualized. And if someone feels that they are healed from a trauma, we as therapists cannot tell them that they're not healed or they need to continue to do work. So I don't know. EMDR and children, I'm so fascinated with it. Like I said, you have me wanting now to become EMDR certified, not just trained. I want to become certified in EMDR, but because this is a podcast for therapists, what would be like an intervention or something that someone that's trained in EMDR would be able to use with a child connected to play therapy?
Oh, sure. Yeah. So trauma comes with images, it comes with emotions, it comes with body sensations. So play therapy is just a fantastical way to work with children that doesn't rely on words. Some people, I think, mistakenly think that it's just a way to get the child to talk, but the healing is actually in the therapy. So what EMDR and play therapy looks like together, let's just kind of go with something that us as play therapists, we love using sand tray. I mean, that's something that many of us use, but, we also use our playroom with the aggressive, nurturing, expressive toys. So we target something. So imagine I ask the child to, suppose they are the bully, the person that's done the bullying behavior. I've had so many clients over the years that they've been the actual person that's bullying, because that bullying is a maladaptive behavior that hurts other people, right? Mm-hmm. So do a sand tray, and then, I'd like you to take the miniatures and represent what's going on in your life right now. And then you ask them, say, out of this whole tray, what's the hardest part? And the hardest part, what I see, may be different than what the child sees or what the parent may see if they had a view of it. But you pick out what the child identifies as the hardest part of their situation, and then you look at the thought that goes with that. So suppose it's a tray and there's a bunch of like dragons around in one area, and then there's one little dragon off to the side. And, with sand tray, we don't name the parts. They may say right here. And tell me about that part. Well, that one's all by itself. Nobody likes it. And then thinking of that, like, I'm not good enough, I'm defective, I'm shameful. So what we do with EMDR is we hold that image together and that thought, we call it a negative cognition. And then we do a thing called bilateral stimulation, which activates the right and the left hemisphere of the brain. alternatively, like one then the other, whether it's through eye movements or tapping or sometimes auditory. There's 3 different ways that you can do it. And through that process of the bilateral stimulation, it helps the brain just kind of move it through, kind of digest, like to use that word that you mentioned. And it takes them to other places. It allows them to kind of move back through their memory network. We refer to it as like in the analogy of kind of looking out the window of a train and watching things go by. And then we pause what's coming up in your mind now, and then we do more bilateral stimulation, pause, and then eventually it desensitizes. And it's like, when you think about that right now, what do you notice in your body? It's like, or how disturbing does it feel? And their image, they'll shift around things in the sand tray, they'll move things, and then you get to the point to where it's like it doesn't feel disturbing at all, and their picture changes in the sand tray or whatever it is that they're doing that we're targeting. And then you move to that positive cognition, or cognition go with it, such as like, I have choices, or now I can do better, or that happened, it's over, and I know differently now, whatever that positive cognition is. And then you install it. EMDR has 8 phases. First, we do the history with the child, and that's that trauma-informed history. And I'm right with you on that big T, little t trauma. Like, it may not, like many clients right now that start in school, they're throwing up when they get to, usually, I get the clients with the tougher situations, but they throw up when they get to school. And for them, that's huge. Or for, like, as a parent, you may be tempted to say, oh, nobody's going to remember that, and just kind of talk them down. For them, that's big. So you take a solid history of what they see as their traumas and their disturbing events, then what the parent sees and any other information. Then you prepare them, you help them to be able to regulate their body and their emotions and to be able to contain themselves in between sessions. And then you pick out your targets. We do an assessment phase, and then we do the desensitization phase, which is phase 4. Phase 5 is reprocessing, and phase 6 is the body scan, because we work a lot with the somatic sensations. And then phase 7, we just close out the session, and phase 8 is usually the next session. We come back and say, hey, when you think about that, whatever it is, I just want you to just do a body scan, notice what you're feeling in your body. And it's developmentally appropriate, so I wouldn't necessarily say that to a 3-year-old, but I might say it to, say, a 10-year-old or a 17-year-old or 40-year-old. It's just really cool. It is technical, though. It does require training. You can't do it without training. It could, actually be harmful if you're not trained in it. But there's different ways you get trained. And then if you want to pursue it, you can get certified. Like you said, that's what you're thinking about. And then the step after that is to be a consultant, to teach others how to really refine their skills. And then you can become a basic trainer, which is a long process, but you can teach people how to do it initially too.
I'm glad you mentioned with a 40-year-old, because a lot of people think that you cannot use play therapy or expressive therapies with adults. And you can, and especially the sand tray can be used with adults as well. And the training aspect of it is a process. And I think a lot of therapists get caught up in the money aspect of it. But this is something that you want to do, is like, it's valuable for your practice, and they don't look at it from that standpoint. So they're like, oh, as therapists, we have to do non-malfeasance, do no harm. You're practicing and you're not practicing. We all have to start off somewhere. But we have to make sure that our knowledge is equal to what we are doing in therapeutic spaces. And you have to have that consultation. And I tell the people that's in my Play Therapy Academy all the time, you need to meet with a consultant. You don't have to meet with a consultant if you're licensed. Our learning and our connections to consultants or supervisors doesn't end with getting licensed. You don't have to meet with them every week like you do to get your clinical license, but you need to meet with some type of consultant that's related to what you are learning or what you are doing, especially if it's a new treatment modality and something that's like EMDR, because it brings those memories to the forefront, right? And so what do you do with that? Do you just leave a client hanging? You just sat in a classroom for 4 days and then you think that you're an EMDR expert and you're trying all of these things that you read about, but you have no training on it. Like you said, there are 8 phases. That is so important. So how can someone become certified?
Okay, so there is...
or even trained.
Trained. Now, there's several different options, but I do want to really kind of highlight what you say about getting consultation and supervision after you are required to get it is so important. You're my go-to. I know when I had a tough case here, I guess it's been a while back now, you made a world of difference. I literally can feel like my heart warm up just thinking about how you directed me. And I had food and had the little activity, and it made that kid's life different because I had the courage to reach out to you, to somebody that's an expert in the situation, and to fill in the gaps where I didn't have the knowledge. So I'll be forever grateful to you for that. But I think you need to keep consultation and supervision open. As long as you're practicing, you need to keep in your mind that you need to go to somebody if it's beyond either your capacity or you just need to process through some stuff. It's tough. But to be trained, there are several different options. So I was trained through EMDRIA, EMDRIA, it's the international organization, but also there's EMDR HAP, the Humanitarian Assistant Program. But it's a 5-day intensive training, or you can do it over the course of 2 weekends. There's several different options, or 2 different options there that you can do. Then after that, you need 10 hours of consultation, and then your basic trainer will run you through that. So I meet with consultees, students all week long pretty much, and just really honing those skills. And then once they get that, the 10 hours complete after the basic training, they are EMDR trained. They do not have to have any more training to do EMDR ethically or, in terms of the requirements. Now, to really hone your skills, it's good to get certified. And that's where you need 20 more hours of consultation. You could do 10 individual, or you could do 20 group, or 10 group and 10 individual. And that's where things really crystallize, and you can pick out a consultant that really works with the population. Suppose that you are a child therapist, or you work with sexual abuse survivors, you can get a consultant that really hones in on that. So I would recommend going to emdria.org, EMDRIA.org for training.
Okay, thank you. Those were the acronyms, or the acronyms that I was messing up in the beginning.
That's a lot. I didn't know until I was far into it.
But yes, okay. So I am definitely going to do this. I'm super excited. You have me excited about doing it with play therapy. And as much as I love play therapy and I see your videos and what you post, and I'm like, oh my God, I need to do this training, because I'm not going to jump into what you're doing, what I see you doing, without having the basic knowledge of it to specialize in it for children. That's kind of like a specialty for children when you implement play therapy with children, and what I see you doing. But like you said, you came to me for a consultation, and I was thrilled because I've been following you for years. And, and I was like, wait a minute. And I'm just being honest, when I saw the email, I was like, is that the Jackie Flynn I follow on Facebook? So I think it's great that, what we do and what we put out and what we present to, I guess, the World Wide Web, because we do it on Facebook and social media, people need to know that it took us time to get to where we are. You can't just jump in, especially dealing with trauma. People are so quick to jump in, and it's like being a trauma therapist or a trauma specialist is trendy, or is the hip thing. And, so many people say that they are trauma professionals and trauma therapists. But when I talk to them, and you don't know the difference between developmental trauma and complex trauma, and that the relational aspect makes the difference of it being post-traumatic stress disorder, then I question whether or not you are a trauma professional, because there are so many aspects of trauma and we cannot know it all. And that's why I seek out consultation. I've been doing sexual trauma for a little over 12 years. And this year I had a case that I got stumped with, and I had to reach out to someone for consultation. And they was like, is this the most difficult case that you've ever had? Yeah. And they was like, I could hear it in your voice, because I was like, frazzled. Like, what am I going to do with
It
this?
can be scary because we want the best for our clients. It
Absolutely.
can be overwhelming.
So I think it's just so important, but people need to know, therapists need to know that what you see other people putting out, that's for your information, it's for your education as well. But we didn't just snap our fingers or wave a wand to get the level of knowledge. It takes practice, it takes time, it takes money, because you have to go to training. You have to do supervision to get to a certain level to call yourself a specialist.
Yeah, absolutely. The things that drew me to you, besides like your amazingness, is the fact that you specialize in like helping children in the foster care system. I truly, I need more training in that. So I think it's important that we all recognize that we need to kind of evaluate what areas do we need to hone in on and just be honest with ourselves. Say, you know what, I know somebody that knows more than me, and I'm going to reach out to them and do whatever it takes to do the best for my client, because that's what it's about. It's not about any ego or the letters after a name. It's like, I know Althea, this is her jam, and I have these pieces, but I don't have this piece. And quite frankly, I'm feeling really overwhelmed. And I want to make sure that I am the best therapist version of myself, and I have the best situation to offer. And girl, you really helped. I can't tell you. I'll remember that forever.
Well, thank you so much. And I tell therapists and I tell other people that I want to be in rooms. And when I say rooms, that means the connections that I make. I want to be in rooms with people that know more than I know or different than I know. And that's how I grow as a therapist.
That's probably why you are how you are.
So anything else you want to tell us before we close out?
One more thing I would like anybody listening, if you are looking for more resources, we have a Facebook group that's free of charge. Lots of great information in there, amazing people. It's called Play Therapy Community. And also there's a members community. It's called Play Therapy Members Community. And you could just go to playtherapycommunity.com. And there's lots of things you can download, you can access. I just did an interview with Julia Cook, the author of
Wow.
Doing her book.
Yes.
Yeah, lots of techniques. There's so many things I can't even discuss them all.
Yes, and I am a part of the Play Therapy Community group on Facebook. Lots of information. Like I said, that's how I started following you. Put out lots of great information, thought-provoking questions. So that will also be in the show notes so people can find it in the show notes. And I just want to say thank you so much for being here. Thank you all for listening to another episode of Chronicles of a Play Therapist. I am your host, Althea T. Simpson. Thank you for playing, and until next time, play well.
Chronicles of a Play Therapist is sponsored by Unicorn Life Play Therapy Academy, where play therapy is magical. Thanks for listening, and don't forget to subscribe in your favorite podcast app and follow us on YouTube. Chronicles of a Play Therapist is intellectual property of Althea T. Simpson. All rights reserved.